Now, let's now move to our regular segment for Mondays, where we turn to a medical expert for a more in-depth diagnosis on the current issues surrounding COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you for joining us.
Thank you for having me.
Well, like we've just heard, South Korea will be under slightly revised social distancing rules for the next 4 weeks. And though a large part of the rules are similar to the most recent restrictions, in the sense that we remain under the highest 4th level, authorities gave some leeway for people who've been fully vaccinated. One big change was to allow up to 8 people to gather at home over the Chuseok holidays on the condition that half of them are fully vaccinated. Dr. Tan, how do you assess the latest measures? Do you think it will be effective to curbing the spread?
I don't think it's going to decrease the spread, but perhaps it will keep the conditions stable. One piece of good news, and I think a motivation for allowing for this, was that the number of critically and severely ill patients has gone down by 10% since the beginning of September. And so now that there is some space in ICUs, a little bit of breathing room, I think that they are allowing for family members to gather. Of course, this is Chuseok holiday is the most important holiday, and everyone, I think they are eager to support each other in a family setting. I think that needs to be the message. It's not a time for everyone to just have unbridled fun, right? It's more about paying respects to our elders and just having a family time of connection. But if there's anyone who is, very elderly, frail, immunocompromised, has many comorbidities in the household, I would say to limit the amount of people in the household at one time.
So we still need to take some precautions. Well, the government says that if 80% of the adult population and 90% of the senior population get fully vaccinated, they will shift quarantine measures to the so-called living with COVID-19 by late October. This means that social distancing measures will be eased by that time. Currently, less than 40% of the population have been fully inoculated in the country. Do you think it's possible to reach the government's goal by that time? And is this appropriate under current conditions?
It may be possible to reach those targets, but I would caution people in terms of what to expect even once those targets are reached. For example, let's talk about the state of Florida in the United States again. They have achieved 87% vaccination rates in people aged 65 and older. And for people 12 and older, their total vaccination rate is 69%. So it's quite high. But despite this very high rate, they are seeing very high case positivity numbers, greater than 15% on average. Some of their counties greater than 20%. And one thing to point out is even if we have a high percentage of adults vaccinated, still the youngest children, they will be completely vulnerable to the virus. And in the case of Florida, there have been about 300 deaths in children, adolescents, young adults less than 30 years old. And in my opinion, that's completely unacceptable. And it's something that in Korea we should be wary about once we do reach our target numbers, to think about opening up too much.
Mm-hmm. Now, let's go back to social distancing. The government's latest measures extended the operation hours of businesses to 10 p.m. from the current 9 p.m. again. And this seems to reflect growing complaints from small business owners who've been facing difficulties due to the prolonged distancing rules. How effective do you think the new rules will be for them?
Well, this is a compromise, that we're making. It's always a balance between livelihoods and the economy and infection control. There may be a little bit of increase in business because of the extended business hours, but I think businesses need to take into account that, if the contact tracing identifies their venue as a site of spread, they're going to take a hit in terms of their business is probably going to have to close for a few days. And so I think this really puts the responsibility on individual businesses to really follow all of the recommendations in terms of disinfection, ventilation, keeping doors open as much as possible, and crowd control within their businesses, making sure that there are not too many people at once and there's adequate spacing. So, I think the baton has been, shared to the business owners, and it's up to them to really follow all of the guidelines very closely.
And lastly, over the weekend, we've seen news that the Mu variant has been detected in South Korea for the first time. It's all the more concerning that not much is known to us about the variant. Can you give us some background on this strain, and why is this variant highly concerning?
The Mu variant was first discovered in Colombia in January 2021, and it has, in the laboratory setting, it has some escape properties. In other words, there might be some resistance of this strain to the currently used vaccines. However, in real life, we haven't really seen that to be the case. And so that's why it's being watched very carefully. In terms of transmissibility, it is more transmissible than the original Wuhan strain, but perhaps not as transmissible as the alpha or gamma strains. As you said, there are many questions still about this variant. It has been classified as a variant of interest now by the WHO, and it should be watched. I don't think that it will overcome the Delta variant in terms of its dominance, but we do need to be careful, because if it does have escape properties, that means that we may see more breakthrough infections. And so that's something that we need to really monitor for.
All right. It's time for us to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Dr. Tan, thank you again so much for your insights. We will see you again next week.
Thank you.